Medicare enrollees are at risk of losing access coverage at the only hospital in downtown. Mercy Health St. Elizabeth was found to be not in compliance with Medicare requirements after a review on September 3rd. Kaitlyn McCarthy explains what losing the accreditation would mean for the hospital and how long they have to make the needed fixes in tonight's Watchdog Report. Kaitlyn.
Derek, the letter sent to the hospital doesn't specify what problems led to the possible loss of certification, but it came just days after a patient fatally shot himself inside the hospital last month. After having Medicare certification for as long as the program has existed, Mercy Health St. Elizabeth is now at risk of losing it. The hospital was sent this letter stating, "We have determined that Mercy Health St. Elizabeth Youngstown Hospital is not in compliance with the following Medicare condition of participation for hospitals."
Losing that status can cut off a substantial portion of a hospital's revenue, particularly for hospitals that serve maybe more rural, more underserved areas where the percentage of the population is a lot more aligned with Medicare, Medicaid.
Condon says revoking Medicare or Medicaid licensing is not common, but often happens after a serious, harmful event.
That could be something like a patient death due to safety failures, could be significant and severe infection control breaches, or just wider non-compliance over a lengthy period of time with some of CMS's conditions for participation in the program.
While the hospital is at risk of losing the accreditation, the letter also says Mercy Health can take steps to come into compliance with the Medicare conditions of participation and reapply to establish the hospital's eligibility to participate. Mercy Health released a statement about the letter, stating a recent survey finding at Mercy Health St. Elizabeth Youngstown Hospital demonstrated areas to be addressed. We take this matter seriously and are focused on improving our processes as we develop a plan of action to address all concerns.
In cases like this, CMS usually gives hospitals a period of time to correct these issues, which can be up to 90 days or so before funding is fully withdrawn.
If changes are not made, St. E's can lose its Medicare certification on December 17th. With more local news, I'm Kaitlyn McCarthy.